John and Paul started out listening to Skiffle. Now they're ready for the Medicare for the Lazy Man podcast. The Medicare podcast, hoping for the best, but fearing the worst. And now, wondering exactly why junior high became middle school, it's Medicare expert Doug Jones.
Well, hello again, you Medicarians, you. How are you today? This is your buddy, Doug Jones, Medicare expert. I'll be here all week, and I'm looking forward to answering your Medicare questions and spouting a bunch of Medicare knowledge that, frankly, I'm always excited to share with people, but I'm asked too infrequently. So why don't you ask me, at least mentally, about Medicare? Well, here's what I would say if you were to do that. Medicare is a big, giant federal bureaucracy. We're all forced to deal with it at some point in our lives, typically at about age 65, or maybe at much older age when we decide to retire from a large company that has provided our health insurance. So Medicare then lays in wait for us. How do we deal with it in such a way that we come out the victor in any contest involving Medicare? Well, the one way I can think of to do it would be to buy a copy of my book, Medicare for the Lazy Man 2026. It is a fairly concise description of Medicare, why it's there, what it does, and how you can enter the world of Medicare in such a way that you're going to have the maximum freedom of choice, the maximum coverage available to you without any nasty surprises, and the minimum cost to your budget, the most reasonable cost possible for the best health insurance coverage possible. That's my goal for you, and it's all contained in the book Medicare for the Lazy Man 2026. Now, I've got a couple of other books that I'm also very, very confident will be helpful. One of those is Medicare Drug Plans, a simple DIY guide. DIY meaning do it yourself. This is a book that will allow you to go to the government website and enter the appropriate information in order to select the best, meaning cheapest, drug plan that's available in your area. There are drug plans all over the United States. There are typically from 8 to 12 drug plans available in every location, the location being your residence address. And so it's a matter of selecting the one best plan out of all the plans available to you that will cover your drugs at your favorite pharmacies for the smallest out-of-pocket cost. That's the plan that's best for you. How do you discover which of the plans available is the one that's best for you? Well, you have to go through a little process on the government website. I do that for my Medicare supplement clients, and you can have that done yourself without any annoying insurance agents by using the hints in my book, Medicare Drug Plans, a simple DIY guide. That's on sale at Amazon. It's a $10 item, or if you buy the Kindle version, that's a $3 item. There's also an Audible version. I don't know what that cost is, but it's got to be pretty reasonable. And now, of course, the newest edition is going to be changing its title. Right now it's called Medicare Bare Bones, but I'm going to change the title to something that's actually more descriptive of the content, and it's going to be called Medicare Enrollment Guide. And this book is now, and it will be in its new form, a guide to the proper enrollment in Medicare, Medicare Parts A and B, your Medicare supplement versus Medicare Advantage, and finally, a blurb about, well, several methods about picking out the drug plan of your choice, the one that's going to be the best for you. Those are the items that are touched on in the Medicare for the Lazy Man Enrollment Guide, and it's going to be a very inexpensive item. In fact, I'm going to give it away free to anybody who asks for it. I'll send you a photocopy of the pages of the book as an attachment to an email. You'll be able to get it on Amazon.com for, I believe, the sale price is the minimum they allow a book to be sold for. Paperback would be $4 and change, and the Kindle version would be $1. And that would be if you buy it at Amazon, but you can always get a photocopy of it for free by coming to me. And Randy has promised me he's going to put it on the website so that people will be able to go to the website and download it for free. Just as soon as I finish my rewrite, I'm never satisfied with what I've written. I'm always a little more verbose than I should be, so I'm in the process of narrowing it down. It's going to be short, sweet, to the point, and it'll be the most powerful book in Medicare. I can guarantee you that. Speaking of guarantees, Randy has guaranteed me that we've got an exciting episode, but I don't know how he knows that. So, Randy, how do you know what I'm going to be? I might just be playing tiddlywinks with myself during this episode. And
Well, I have this. I have the session notes, so that's the reason I know.
oh, okay. I forgot I shared those with you. I thought I kept them a secret. Yes,
No.
I am. I've listed a whole bunch of things. It's always more ambitious when I write these notes out than when I'm actually trying to get to all of them. So I always wind
Yeah.
up leaving a lot of stuff on the table.
Yeah, me too. Well, I got a couple questions for you while you're here.
Well, ask away.
Uh, you know, Over the course of the last couple, three episodes, we've discovered in your discussions, because you're the expert. I'm just the guy, the tech guy. I'm no
Well,
expert.
without you, we'd be sitting here talking to each other.
Okay. Well, some days we do that, but
Well, maybe. I hate to think about that.
so I've got a question for you since you're the expert. Bottom line is, over the last several months, and certainly in the last two or three or four episodes that we've recorded, it sounds like the government has finally pulled out their head of where the sun don't shine and has gotten, a little bit mad at
Yep.
the Medicare Advantage plan people.
Well, it does sound like that. I hope it's true. We've been
You know what?
disappointed.
Go ahead.
Well, we've been disappointed by government, inaction in the past. I hope we're not disappointed by again.
Well, do you know, have I ever told you that what MAD stands for?
Mutually assured destruction.
Well, yeah, that could be. That's
One
not
of
in
my
this particular case, but yeah,
one,
yeah.
one of my favorite magazines.
Mad Magazine, yeah. Well, in this particular case, since I am the nominal guy defining acronyms,
Uh-huh. Uh-huh.
okay, MAD in today's world stands for
Yeah.
Medicare Advantage debacle.
Oh boy, and that is true. I think they are facing headwinds.
Yes,
I
headwinds.
bet you're shocked that I was able to use that term
Oh my
correctly.
gosh, yeah. One of these days we'll have to do this. We'll have to do a whole episode using corporate speak.
Well, I don't know that much corporate speak, but I got a few gems that I really hate. You have a few gems that you really hate. And between
Oh,
the two of us, I think we could talk about things we don't
yeah.
like and make
Yeah,
up a
well,
whole episode.
I think we could definitely do that. And the other thing I was going to ask you is, we haven't talked about Medicare drug plans, or just drug plans in general.
Yeah.
One thing that came to mind was Curly, Larry, and Hey Mo.
Oh, yeah. Yep. That is our favorite service, our subscription drug plan selection service. And I love those guys. Did you have a specific question about them?
No, just they popped into my head, and I think it's a really good service, and I'm also trying to come up with some sort of an acronym to wind them into my, something that you could never forget. And what would be something else you could never forget?
Oh, boy. That's two questions wrapped up into one. I don't know how
It's
to answer
it's
that.
a small world. Don't
Oh,
ever
yeah.
start singing it. Don't, no,
No,
no, please
I
don't.
never will. I didn't know what I was. My father took my little sisters to Disney World before I was ever there. And so I think I make it part of a podcast episode when I explained how that song came to be.
Well, I know we've talked about it, and I'm pretty sure it got on one of the recordings. Yeah.
Okay, then I don't have to do it again, but it is kind of an interesting story. But my father came back as a father of two young girls, came back and holding his ears going, "Oh, please, Lord, I can't get it out of my head." And he had driven. So he had several days on the road to recover from the trauma of having It's a Small, Small World sung repetitively. And that song has overtaken Happy Birthday as the most often played song in the whole wide world.
Well, the other thing that popped into my head is that, you know, we were using sound punishments, a few years ago on prisoners.
Oh, yeah, Noriega is one
Yeah,
example.
yeah. I think that would be perfect. It's a
Yeah,
small world after all.
yeah.
24/7, run it over and over again.
I'd say in the Democratic National Committee headquarters,
Well, I don't think
that
they'd
would work.
understand. I don't think it would stick in their head because I'm not sure they have any brains someday.
Well, that's true because they're certainly not as honest and forthright as we would like them to be,
No. Yeah,
and many of them anyway.
you're being very nice, Doug. But
Oh,
anyway.
well, I will say the senator from Pennsylvania has surprised me with his reasoned opinions on many things
Yes.
that other lefty Democrats do not agree with him on. But I think he's turned into one of the most reasonable Democrats around, which is a surprise to me. So anyway, you mentioned Hey Mo, and I should put in a word for them. They have a fantastic computer generated drug plan selection process that is more sophisticated than the one that I offer that's based on the government drug plan or the government website. And so when Hey Mo has an opportunity to look for a drug plan that's suitable for a particular individual, they draw from many more sources to find discounts that are possible and sources of very expensive drugs that may be discounted. And they just have all kinds of sophisticated resources at their disposal. And for that reason, I offer it's a subscription service with a very reasonable price. I offer a discount if somebody were to ask me for their email address. What I would do is send them a link which allows the individual to get a discount off of their subscription price. So I heartily endorse Hey Mo as a way to search for the least costly drug plan that's available in your area, especially if you have a complicated drug regimen or you take a lot of drugs. Their service can be very valuable and will most likely pay for itself in no time flat. And so with that, we go back to, and I think I've satisfied Randy's curiosity. He's Mr. Curious sometimes. So what do we have in the Medicare Advantage Minute for this episode? There's a wistful headline. Somebody who is a CEO of an insurance company says that it's possible, and he asked the question, what if we could eliminate prior authorizations? Well, I should explain that prior authorizations is a tool that Medicare Advantage plans, and frankly, all managed care plans, but we're talking about Medicare here. So Medicare Advantage plans have a tool that they can use to slow down payments, to deny coverage or delay coverage for their I don't want to call them beneficiaries, their members, by forcing the doctors to request permission in advance before they go through a course of treatment. Now, a course of treatment may be covered, but it may not be authorized, and the prior authorization will tell the tale. So let's say the doctor wants to operate on you. It's not an emergency, but it's something that you desperately need. Let's say a knee replacement, because we've had a couple of those in our household. Well, the doctor has to beg the permission of the accountants at the Medicare Advantage Plan office and then wait for them to respond. In some cases, they'll respond promptly. In other cases, they'll drag their feet. The response won't be forthcoming. The doctor will have to follow up again. Well, in order to get all this paperwork done, the doctor has to pay money out of his pocket to hire staff to handle this sort of thing. But in any event, once the answer comes in, it could be that the prior authorization gives the green light to the doctor to go ahead and perform the surgery that he wanted to do, or it could be that they demand additional evidence that the surgery is necessary, or it could even be that they deny the surgery, and that forces the doctor to go back to the drawing board and resubmit everything, maybe with a different code. Every procedure has a code, and they've got a big giant book with all the codes in it, and some of these Medicare Advantage plans will use the prior authorization as a tool to reduce their cash outlay and delay and sometimes deny medical treatment that doctors and patients often think is going to be very helpful to the patient. So this article, again, asks the question. It's kind of a rhetorical, not a rhetorical question, a hopeful question. What if we could eliminate prior authorizations? Well, the article goes on to say every CEO and, every EVRY Health CEO and co-founder Chris Gay thinks that health insurance industry could eliminate prior authorizations entirely, but only if providers meet insurers halfway. Oh, okay, turn it. So the question is, every health has achieved, that's the EVRY Health, I don't know where that is, has achieved a 7% prior authorization denial rate with 100% of those denials upheld on appeal, meaning that they were all reasonable and defensible. So what's the biggest obstacle preventing larger insurers from replicating what they've built there? And the answer is it's a technology issue because of the scale. Prior authorizations are a shared frustration by both the medical provider and the health plan side of the industry. But we have a job in population health to look across health systems, he talks funny, employers and state plans. When we do that at a large data level, you see a lot of variation in clinical care. And that impacts medical quality and patient experience. Because it's a big data problem and because it involves a lot of complexity, it is perfect for technology to solve. Let computers do the boring, challenging work of matching records, doing eligibility for patients, facilities, providers, and the code checks. That's also why the software is a superb solution and why we're happy to license what we do for other people. So apparently what this little company has done is created software that performs the prior authorization tasks rather than forcing humans to do it, which I think probably would be an admirable goal, except for the fact that human presence in any negotiation or in any complex task allows one to have a more properly tailored outcome if that human intervention or if that human participant is so inclined. That's just me talking. So then the next question in this article is this also a business model problem? And the executive says, absolutely. You've got organizations on the payer and provider side that are trying to minimize margins. And then there are times to have a margin. If you have no margin, you have no mission. Oh, boy. On the payer side, meaning the insurance company side, some organizations have expanded the number of codes that they put under prior authorization so they can have a little more time to evaluate because too many things were getting pushed through that did not meet medical quality standards. So he was saying that there were too few delays in the prior authorization process in some insurance companies. On the provider side, you've got organizations that have contracted out their revenue cycle management and are not even talking directly to the health plan. The third party is often submitting for anything they can think of and often resubmitting. This is just a couple of examples of how both sides have weaponized against each other, and it's fundamentally because business models aren't aligned around patient care. This is why AHIP, which is American Health Insurance Plans, has stepped forward on this. 50 health plans, including this guy's company, EVRY Health, Every Health, are going to lead the industry on reducing the codes and enforcing more digital submission. We want patients to get an answer quickly. Well, I applaud that. And we're going to do this all based on improving medical quality and patient experience. Many states have passed prior authorization reform laws this year. Do you think voluntary industry-wide commitments are a better path forward over a patchwork of state mandates? And the answer is, speaking only for myself, I'm not a fan of patchwork state regulation because health plans, especially on the population health side, span multiple states and it just creates system complexity. I'm more a fan of the voluntary initiatives that we were part of through the AHIP, the American Health Insurance Plans, that looks on this nationally. Well, I could go on, but basically, at least one executive of a health insurance company out there, a Medicare Advantage company, thinks that the problems surrounding prior authorization frustrations and delays and denials can be solved by the use of technology. Maybe that's true. I don't know, but he's more confident about it than I am, I think. 40 million Americans use AI for healthcare. And they specifically said here, ChatGPT. 40 million Americans use ChatGPT for healthcare. Doctors used to talk about Dr. Google, but I'm guessing that they're going to be talking about Dr. AI in the future. More than 40 million Americans use ChatGPT daily to ask questions about healthcare, according to a new report from OpenAI that highlights how patients and clinicians are increasingly turning to AI to navigate complex and strained U.S. healthcare system. The report, AI is as a healthcare ally, how Americans are navigating the system with ChatGPT, was shared with Becker's. Becker's is a health insurance and hospital management company that they do accounting, they do observation and reporting. And so every once in a while, they have some interesting articles. And I go to Becker's every day to see what they're writing about, just in case there's something that would be of interest to the audience. So here are 8 key findings from the report. More than 5% of all ChatGPT messages globally now relate to healthcare. In the United States, the findings point to growing reliance on AI tools as patients grapple with rising costs, access challenges, that would be prior authorizations again, and administrative complexity. OpenAI also found that 7 in 10 health-related conversations on ChatGPT occur outside of normal clinic hours, which underscores the demand for information when doctors' offices are closed. The report highlights particularly heavy use of ChatGPT in rural and underserved areas. Users in rural communities send an average of nearly 600,000 healthcare-related messages each week. In areas it defined as hospital deserts, locations more than a 30-minute drive from a general medical or children's hospital, ChatGPT averaged more than 580,000 healthcare-related messages per week during a 4-week period. Wyoming ranked highest among states in the share of healthcare-related messages. I assume that's because their population is kind of sparse, followed by Oregon, Montana, South Dakota, Vermont. Beyond patient use, the report also points to the rising adoption of AI tools among healthcare professionals. 66% of U.S. physicians reported using AI for at least one case in 2024. That's up 38% from the prior year. And finally, OpenAI said that healthcare workers are using AI for tasks such as documentation, administrative work, diagnostic support, and managing burnout. Wow, how do you use AI for managing burnout? Oh, that's interesting. In any event, while patients use the technology to better understand symptoms, prepare for clinical visits, and navigate insurance and billing challenges. Well, when they say that AI is going to be taking over a large part of our activities, I think that's one indication that that's going to happen. When you have a podcast and you start to gain traction and you start to have enough listenership to get people's attention, there's a class of people that will contact you and kiss your butt to try to get take over some of your podcast time in order to further their goals in life. And the most common thing that I see is that I'm approached by the representatives of people who want to be podcast guests. And these are publicists for the most part. I had one that was very persistent, and she tried to set up a meeting between a Medicare Advantage advocate and me. And we talked about it back and forth last spring. And I said, okay, well, I think, you seem to be an interesting guy. and I'd like to have you as a guest on my podcast, but I wasn't going to take the publicist's word for it. And so this guy said, well, I got to go out of town. I'll get back to you when I return. And I never heard from him again. So I may still, but I may be on his list of things to do, just not as high as some other obligations he has. But I got an email very recently from a woman, and she started out the way of all publicists by kissing my butt. And she, especially with those with government glitches that you mentioned. Ray's question about plucking or picking the best prescription drug plan reminded me of how overwhelmed people can get when it comes to not just their insurance, but also the equipment and the solutions they need at home. With my background as founder, now see there, she took careful notes during one episode and then let me know at the very top of her message how she was a big fan. And here's proof. I remember exactly the details that occurred on one of your episodes. So then her message goes on, with my background as a founder of Harmony Home Medical, I've spent years guiding folks through the maze of Medicare insurance, restrictions and confusing product choices. After watching my own family navigate this landscape, I set out to make it simple and personal, offering clear educational and options beyond what any insurance company recommends. I'd love to share that experience. Here it goes. I'd love to share that experience with your listeners so they can make smarter decisions about both coverage and care at home. I believe your audience would appreciate some insider stories about how to truly take control of their independence to avoid common pitfalls and to find accessible solutions that genuinely fit their lives. If you think this would help complement your down-to-earth, stress-free approach to Medicare, I would be thrilled to join you for a conversation. Thank you for always bringing humor and clarity to what usually feels like a daunting topic. Looking forward to hearing your thoughts. Signed, Erica. So here's a difference. Erica contacted me herself. She did not have a representative do it, a publicist do it for her. But I still didn't think that her topic, which is aging in place, how to prepare your home for your inevitable coming difficulties in negotiating daily life. I thought, that just doesn't seem like the kind of thing. Our podcast efforts here are more directed towards people who are coming to Medicare and trying to make choices about Medicare. And I didn't think that a person who's already made those choices years before would be fodder, the kind of content that we normally have for our audience. So I tried to turn her down gently. I said, thank you very much for your kind words. I don't think my primary subject of making the best choices when enrolling in Medicare is really compatible with your primary subject matter. Yours is farther down the line, closer to the end of the road. I can't figure out how I would make that lighthearted and entertaining. I appreciate having the opportunity to consider it, though. Have a happy new year, Doug Jones. And so she wrote me back and she said, the only talking point directly related to that, I think, might be helping audiences by warning them to stay away from, warning them to stay with standard Medicare and not an HMO. And that tends to be the best option if they need durable medical equipment. Even at that, there are many gaps in equipment coverage that people should plan to private pay, like bathroom aids, grab bars, home access. Most scooters are all private pay. Maybe share that with your audience. And then she has a little emoji grin. I don't think that's enough for a whole podcast either, but have an awesome 2026. So she turns out to be a very nice lady who does have a legitimate concern. It's just that we're talking to different audiences, I believe. And so she did support my thought that Medicare supplement with original Medicare is the best way to go, because if you come to need durable medical equipment, that's going to give you the broadest possible choices of items that are covered by Medicare. Not everything will be, but that is the choice to make if you want to ensure your happiness. And that's very consistent with my routine message of stay away from Medicare Advantage, only go with Medicare and a Medicare supplement, and only go with Doug Jones and Randy Carson if you have that chance or that choice.
You know something, Doug?
What's that?
We're out of time.
How did that happen?
I don't
I was
know.
just getting warmed up here.
I know. It's really bad. We're off and running on 2026, and we're all bright-eyed and bushy-tailed, and we're just
Uh,
running out of time way too quick.
ugh.
So, having said that, we need to do a few things here before we close up shop. And I was just wondering if this made any sense to you whatsoever. We're thinking about being sounding more professional in 2026 by using a lot of corporate speak.
Yeah,
So,
yeah. Okay.
so I was going to run this up the flagpole. What do you think?
Well, let's see if I saluted.
Okay,
Uh,
there you go.
okay.
So here's the other. Now this is a personal idea.
Okay.
Everybody is talking about Medicare Advantage plans and how that's such a bad thing.
Yes, it
But
is.
on the other hand, the companies use that as a way to control their cash flow.
That's exactly right.
So then I came up with an idea of RAP, RAP.
Ugh, that doesn't sound good. This white boy here. No.
Randy's Advantage plan. So when
Okay.
somebody sends me an invoice, I'm going to say, well, I'm going to need some more information on that. And bottom line is I'll delay payment for, a couple, 3 years like, Medicare Advantage plans
Yeah,
do. And
drag your feet,
I'm going to save a lot of money.
age your receivables,
Yeah.
or no, those are your payables, I guess. And you can age them right into oblivion if you play your cards right.
Yeah. Yeah. Well, just like the Medicare Advantage people do.
They do that. They're perfectionists at it, and they have perfected their techniques. I bet you could take a few pages out of their book.
So you think that's a good idea?
Well, not for me, but but for your other associates, maybe.
All
I would
right.
not discourage you from trying to be creative and trying to be
So
more successful.
So don't be surprised if you hear the acronym RAP,
I
Randy's Advantage Plan.
As long as I don't have to listen to it set to music, then that'll be fine with me.
All right, well, we need to get out of here. We've run out of our quarters, and obviously you're a busy man today for obvious reasons. And there's the three or four things I always need to take care of is get your pencil, because this email address is one of probably the very most important email addresses you could have. I would actually paint it right on the front of your refrigerator. It's dbj@mlmmailbag.com, dbj@mlmmailbag.com. You can write to that any time of the day or night, and Doug will answer you, trust me. Licensed nationwide. Who is that? That's Doug Jones. He's here to help you with every state in the union for your Medicare supplement planning. MedicareForTheLazyMan.com. Check it out. That's where all the good stuff's happening in terms of our website. Write a few reviews for us. I mean, we've got a long time now before the end of the year, but start dropping reviews because we still want to stay ahead of the travelogue people. And we've won out past the travelogue people for years, and we do not want to miss doing that in 2026. And also, I must say thank you for joining us. We always love to have you right here with us listening to Medicare for the Lazy Man podcast. And nobody ever checks their watch. I don't know why. I've always thought about that. So I guess I just need to announce it. You have just spent about 32 and a half minutes with Doug Jones, the insurance guy, originally from Oklahoma. No more living up in the Nosebleed Mountains behind Cave Creek, Arizona, the home of the Nosebleed Indians. And I'm going to put him in at about 6,600 feet because as far as I know, he's trying to get his pilot's license, and as far as I know, I don't think he can go any higher than that with a SPAD.
I've been higher than that, but not recently and not in a World War I SPAD. So you're exactly right. And I appreciate the 6,600 feet. That sounds very tropical to me. So thank you, Randy. And thank you, ladies and gentlemen, for joining us today. It's been wonderful having you. I'm looking forward to our next episode, and I hope you will join us again as well. Bye-bye.